examples involve lip and tongue patterns. First, you will see 3 normal lip patterns. In lip rounding, the lips can easily form a circular shape, maintaining muscle tone balance. For lip spreading, the lips can easily form an expanded horizontal line from the rest position. In lip closure, lips meet and touch to seal off the contents of the mouth from the outside. All 3 of these movements are attained through easy, non-forceful movement. Now let's look at 2 abnormal lip movements. In lip retraction, increased abnormal tone pulls the corners of the lips up and back. This may affect upper lip movement more than lower lip movement. For lip purse stringing, the corners of the lips pull back as the rest of the lips pull to midline with an increase in abnormal tone. The increased tone may extend from below the nose to the chin and cheeks. Tongue movements are an integral part of the eating process. The following 6 normal patterns are presented in order from primitive to more mature patterns. The first pattern is suckling. Notice that the primary movement is extension, retraction. The tongue is not extended beyond the lips. Lateral movement is not observed. The movement has normal tonal changes and rhythmical cycles. Simple tongue protrusion is the second pattern. This is a primitive normal movement associated with the suckling pattern. The tongue extends between the teeth or gums and remains flat and thin with no abnormal tonal changes. The third normal tongue pattern is sucking. The movement involves rhythmical up and down cycles with the tongue contained in the mouth. The tongue tip rises to the anterior hard palate. The fourth pattern is munching. The primary movement of the tongue is flattening and spreading. This is a normal tongue pattern observed in early chewing. Tongue tip elevation is the 5th tongue pattern, and it emerges during sucking. The anterior 1/3 of the tongue rises upward to contact the upper teeth or alveolar ridge, the gums behind the upper teeth. This indicates separation of tongue and jaw movement. The final example involves lateral tongue movements. The tongue moves to either side to shift food from the center of the mouth to the side. As skills develop, the tongue can move food from one side across the midline to the other side. Abnormal tongue patterns are frequently observed in clients with developmental disabilities. The following 4 examples illustrate common abnormal tongue patterns. In the first pattern, tongue thrust, the tongue is thickened and bunched. The movement is primarily an outward extension beyond the border of the lips. The movement is forceful and is associated with an abnormal increase in muscle tone. Tongue retraction is when the tongue is thickened and bunched. The movement primarily involves retraction, a strong pulling back of the tongue to the posterior portion of the oral cavity. This pattern is associated with abnormal muscle tone. A mildly abnormal pattern is exaggerated tongue protrusion, in which the tongue shows non-forceful extension beyond the border of the lips. The final example is asymmetrical tongue placement or movement, in which the tongue deviates to one side or the other and may show atrophy on the affected side. Jaw patterns also affect nutritional management. The following examples illustrate 7 normal jaw patterns. Phasic biting is a primitive normal jaw pattern characterized by rapid rhythmical up and down movement of the jaw with no lateral movement of the jaw. The second example is munching, an early chewing pattern which combines phasic biting and some non-stereotypic vertical movements accompanied by sucking movement of tongue. There is no lateral movement of jaw or tongue. In non-stereotypic vertical movements, the jaw moves up and down with easy contact and release and a variable rhythm or pattern. The fourth example involves wide jaw excursions. An early pattern characterized by poor jaw grading in which jaw displacement downward is exaggerated, but is not associated with abnormal tone. Diagonal movement is a lateral, downward movement of the jaw to either side with easy contact and release. This movement aids in placement of food between molars for chewing. Diagonal rotary movement is a combination of lateral downward movement with upward horizontal sliding movement for grinding foods between molars. The jaw moves to one side or the other without crossing midline. Finally, circular rotary movement is the most mature chewing pattern, involving jaw movement laterally, downward, across the midline to the other side, and then upward to close either clockwise or counterclockwise. While normal jaw movement facilitates eating, abnormal jaw patterns cause many clients problems. Three major abnormal jaw patterns are tonic bite, jaw thrust, and jaw retraction. Tonic bite is a forceful, sustained upward movement of the jaw or mandible, which occurs following stimulation of the teeth or gums and is accompanied by increased abnormal tone in jaw muscles. Jaw thrust involves a forceful, sustained downward or outward movement of the jaw. It is accompanied by increased tone in jaw muscles. Do not confuse this pattern with wide jaw excursions or poor jaw grading, often seen in normal infants. Finally, jaw retraction is a forceful, sustained movement of the jaw, carrying it up and toward the back so that the alignment of the molars is displaced. This is associated with an abnormal increase in jaw muscle tone or change in body position.